Hello everyone. Today we are going to be discussing about migraine. As I have already said that we are going to talk about migraine in a great detail because of it is because of it is important actually in the aspect of medicine. So as far as headache is concerned, so now we are going to begin actually. So actually migraine headache actually by definition migraine can be defined as an episodic headache which affects the unilateral part of the head and then associated with throbbing and pulsating sensation in the affected side. That is an episodic actually. It's an episodic. It's occurring in an episode. Episodic is an episodic headache that affects the unilateral side, affecting one side, the unilateral side of head. It may be right side or it may be left side, but in some minority of cases it may affect both sides actually of the head. And it is characterized actually by a throbbing and pulsating sensation, which is very pulsatile. Actually, the patient will describe it as throbbing and pulsatile. Actually, these are the two words mostly used to describe migraine headache. Actually, pulsating sensation. So this is definition. And the migraine headache actually is classified as into two. Actually, it is classified into two categories actually, or into two classes. We have number one, migraine with aura, which is the classical migraine with aura, and then migraine without aura. So what is this aura? Aura can be defined as actually a kind of a prodromal symptoms. That is the symptoms that is experienced by the patient before the occurrence of that particular episode. For example, if the patient is going to develop the kind of the migraine, for example, in the next 1 hour, so in some minute before the attack, he will actually experience the kind of symptoms that may actually give him a hint that definitely I will going to develop this kind of migraine in the next 1 hour or in the next minute actually. So these are the kind of warning sign. These aura they are a kind of warning symptoms that are warning the patient that you are going to develop this kind of attack for another new episode of the migraine actually. So but we have in minority cases the migraine without this kind of symptoms. So what are these symptoms? That is the aura symptoms, which are the prodromal symptoms actually, the aura symptoms. These aura symptoms are actually neurological symptoms actually. Mostly the most important symptom is actually a kind of flashes. The patient will be experiencing a kind of flash light in his eyes actually. So that is flashes in the eye. So he will experience this, and then some patient will be actually kind of having some kind of partial loss of vision also sometimes. Partial loss of vision. So this is the most important. Actually, these are the most important and the most commonly associated aura with this migraine. Actually, what would in the migraine with aura category. So that is it. And then this migraine actually is triggered by some kind of factors actually, which the trigger in each episode. One of the uh, one of the following factors is said to be the kind of trigger of that particular episode. So the factors that trigger this migraine triggers, they are number one, we have lack of sleep or inadequate sleep. Lack of sleep in the night or at night. So lack of sleep at night or inadequate sleep actually, skipping of meals, that is say hungry, like right, skipping of meals, actually taking coffee during menstruation. So since this attack can be triggered by menstruation, so it means there are some kind of hormonal changes, because during menstruation or toward menstruation there is a kind of fluctuation in the hormones in the female body, right? So this may also serve as a trigger of this migraine actually. So that is it. Then now we are going to talk about the etiology. What is the cause of this migraine headache? The etiology is actually said to be unknown. It is idiopathic. When we say idiopathic, we mean it is unknown. The etiology is not known. What cause, definite cause of the migraine is not known, but mostly it is associated with genetic and environmental factors. Genetic, so which means this migraine actually can run in the family, right? It is running in the family in most of the cases, running in the family in most of the cases actually. And also sometimes it is associated with low level of serotonin. Low level of serotonin. So if someone is having low level of serotonin, so he is at high risk of developing this kind of migraine actually. So that is it. So now we are going to see the symptoms. So what and what are said to be the symptoms of migraine? So the symptoms of migraine, symptoms of migraine. These symptoms include the throbbing, as I have said earlier, throbbing and the pulsating sensation in the head, which is associated with nausea and vomiting. And this kind of headache that is experienced by the patient with migraine is actually a kind of throbbing and then pulsating, and it is associated with nausea and vomiting. And also, one thing to remember is the patient with migraine is actually didn't like light, so this means the symptom is made worse by light. So the patient is afraid of light. So you can say the patient develop a kind of photophobia, because whenever he is exposed to light, he will develop the headache will going to be more worse, right? That is photophobia. And then sound also. The patient didn't like sound. Then that is phonophobia, because this pain during the attack can going to be worse, or it is worsened with light and with sound. That is phonophobia and then photophobia. Then develop this kind of behavior actually. So that is it. And then these symptoms actually can be relieved by working, but can be relieved by rest, and then made worse also by working. That is by movement, and worsen again by movement. So which means light, sound, and then movement can worsen the headache actually. That's it. So, and it's associated with nausea and vomiting. And what make the doctors and then the patient to be very very surprised by the migraine is whenever they vomit, they feel relief actually. So we can say the migraine in some cases get relieved by vomiting also, because of this nausea. Then they vomit. So after the vomiting, then they experience a kind of relief. They get relief, so they get better. So that is it. So now we are going to see the kind of treatment of the migraine. So in the treatment, you have to actually, for you to treat the patient right, you have to actually identify the triggers. You have to identify the triggers. So what are the triggers? If the patient says this migraine attack usually used to come whenever I take chocolate, or whenever I drink coffee, or whenever I skip meal. So actually you have to advise the patient and counsel him in order to avoid that kind of behavior, right? So that is it. That is identify the triggers. Because if you didn't identify the triggers, whenever even if you give him the drug, tomorrow we will come back again with the episode, with another episode, right? So that is it. Identify the trigger and then counsel the patient accordingly. And then counsel the patient accordingly. So that is it. And then the definite treatment actually for someone with migraine is a kind of serotonin agonist. Remember that in the risk factors we have someone who is the serotonin, low levels of serotonin, because most of the patients they are having low level of serotonin. That's why. So you have to give him drug that may substitute or that may serve as substitute with, to serotonin, right? That is serotonin agonist. So example of the serotonin agonist, actually we have sumatriptan. We have another one called rizatriptan. So we have naratriptan. All this kind of triptan. So that is it. Then these are the mostly the definite treatment actually of the of uh, of migraine actually, and also there are kind of some prophylactic drugs, the drugs that are used as a prophylactic actually in patients that experience frequent attack. For example, someone will say almost every day I have this kind of migraine attack. Every day I am having new episode of this migraine actually. So for that patient, they are said to be having frequent attacks. So you will actually prescribe some drugs as a prophylaxis to prevent the attacks actually. That's prophylactic drugs. These drugs are only used when the patient is having frequent attacks actually. But in someone who is having this attack, maybe for example once in a month or twice in 3 months, so this one is not having a frequent attack, right? So for the patient, for this prophylactic drugs, actually give him beta blockers. Mostly give him propranolol. Mostly they use propranolol and then atenolol actually. So this is it. And sometimes they also use a kind of amitriptyline actually. Amitriptyline. And also there's sometimes some doctors used to prescribe, which is very good, so used to prescribe a kind of anti-epileptic drugs. Anti-epileptic drugs, e.g. that's for example sodium valproate. But remember, this sodium valproate is very contraindicated in pregnancy because it is very it can cause teratogenicity. It can harm the fetus. So remember not to give this drug during the pregnancy. Especially frequent intake may put the patient at risk of having problem actually, like neural tube defect or whatsoever. So that is it. And then actually you have to, as I have already said, you have to actually identify the triggers and then advise the patient to not to avoid the triggers actually. If he is skipping meals, advise him to not skip meals. If he is actually drinking coffee, then advise him to avoid drinking coffee. So that is it. So thank you very much.